What happens in the third trimester of pregnancy? You've made it to the final stretch, and now things start to get real. This is the time when your baby is growing rapidly, and you're likely feeling a mix of excitement and maybe a little anxiety. As you prepare for the big day, there are some changes and challenges you can expect. From your baby's movements to the way your body is changing, the third trimester is full of surprises. So, what should you look out for? Let's talk about what's ahead in these last few weeks before you meet your little one. New fetal development. Let's talk about your baby's development in the third trimester. This is when things really start to happen. Your little one is growing quickly now, and by the time you reach full term, they'll likely be between 19 and 21 inches long and weigh around 6 to 9 pounds. One of the biggest changes is that your baby will start to move into position for birth. Around week 36, they usually turn head down, getting ready for the big day. You might hear this referred to as lightning, and it can be a sign that delivery is getting closer. But that's not all. Your baby is also developing in some amazing ways. By now, they can open their eyes and see, hear sounds, suck their thumb, and even cry and smile. Their brain is still growing, and their lungs and kidneys are maturing. Your baby is also gaining muscle tone and body fat, which will help them be strong and healthy at birth. During this time, a protective layer called vernix caseosa covers their skin, while the soft hair, called lanuvo, that covered their body starts to disappear. All of these developments are helping your baby get ready to meet you. Third trimester changes in your body. Let's take a moment to talk about some symptoms that need your immediate attention. While many changes during pregnancy are perfectly normal, there are certain signs that shouldn't be ignored. If you notice any of these symptoms, it's important to call your doctor right away. Abdominal achiness. As your baby takes up more space, you might feel some aches and discomfort, especially at night. Finding a comfortable position to sleep can be tricky, and you may even notice it's harder to take deep breaths. Backache. The extra weight you're carrying can put pressure on your back, making it feel sore. Your pelvis and hips might also ache as your body gets ready for labor. To ease the discomfort, focus on good posture, sleep with a pillow between your legs, and wear comfortable shoes with good support. Bleeding. Light bleeding toward the end of your pregnancy could be a sign that labor is near, but it can also indicate a more serious issue. If you notice any bleeding, call your doctor right away. Braxton Hicks contractions. These practice contractions are your body's way of preparing for labor. They're usually less intense than real contractions, but if they become regular or more intense, check with your doctor. Breast enlargement and leaking. By the end of your pregnancy, your breasts may have grown significantly. You might also notice a yellowish fluid called colostrum leaking from your nipples as your body gets ready to feed your baby. Vivid dreams and clumsiness. Hormone changes can lead to more vivid dreams and even nightmares, which might disrupt your sleep. You might also feel clumsier than usual as your body's balance shifts. Other symptoms you might notice include increased vaginal discharge, fatigue, frequent urination, heartburn, constipation, hemorrhoids, sciatica, shortness of breath, spider and varicose veins, stretch marks, swelling, and weight gain. Remember, each of these changes is a normal part of preparing for your baby's arrival. If anything feels off or overly uncomfortable, don't hesitate to talk to your doctor. Red flag symptoms. Let's talk about some red flag symptoms that you should never ignore during your third trimester. While many changes are normal, certain symptoms can signal that something might be wrong, and it's important to contact your doctor right away if you notice them. Severe abdominal pain or cramps. If you experience intense pain or cramping that doesn't go away, it could be a sign of a serious issue. Don't wait. Reach out to your doctor immediately. Severe nausea or vomiting. While some nausea is common in pregnancy, severe or sudden vomiting isn't. If you're struggling to keep anything down, it's time to get in touch with your healthcare provider. Bleeding. Any amount of bleeding in the third trimester should be taken seriously. It could be a sign of a complication that needs immediate attention. Severe dizziness. Feeling lightheaded or dizzy can be a sign that something isn't right. If the dizziness is severe or doesn't go away, call your doctor. Pain or burning during urination. This can be a sign of a urinary tract infection or another issue that needs treatment. Don't ignore it. Get checked out as soon as possible. Rapid weight gain or too little weight gain. If you notice that you're gaining weight very quickly, more than 6.5 pounds in a month, or not gaining enough, it could indicate a problem. Your doctor will want to monitor this closely. Remember, it's always better to be safe and check in with your doctor if something doesn't feel right. Your health and your baby's health are the top priorities. Third trimester tips for twins. Expecting twins? That's amazing and exciting. As you head into the third trimester, there are a few extra things you'll want to consider to make things go a bit smoother. Go stroller shopping. With twins on the way, a good stroller is a must. You'll need to decide between a side-by-side or tandem model. Try out a few to see which one feels the best for you. Look for one that's easy to open, close, and maneuver, so you'll be ready for those busy days out and about. Get breastfeeding tips. Breastfeeding twins can be a bit more challenging, but it's definitely doable. Reach out to your doctor or a lactation consultant for advice on how to manage feeding both babies. Check your iron. Moms of twins are at a higher risk for iron deficiency anemia. Ask your doctor if you need to take iron supplements to keep your energy levels up. Know the signs of preeclampsia. Carrying twins doubles your risk of preeclampsia, a serious condition. Watch for symptoms like headaches, vision problems, or sudden weight gain, and contact your doctor right away if you notice any of these. Find a support group. Connecting with other moms of multiples can be incredibly helpful. Look for local support groups or online communities where you can share experiences and get advice. Create a schedule. Getting your twins on a similar sleeping and eating schedule can make life easier. Start learning some strategies now so you'll be prepared when your little ones arrive. These tips can help make the transition to life with twins a bit smoother and more manageable. And that wraps up our guide to navigating the third trimester, whether you're expecting one baby or two. If you found this information helpful, don't forget to give us a thumbs up and subscribe for more tips and advice. Leave a comment below if you have any questions or if there's a topic you'd like us to cover next. Thanks for watching, and see you in the next video.